Hi, everyone. Thank you so much for joining us today for this webinar, Inflammation and Your Health. I am Ashley Moody. I'm one of the health educators from Optima Health's Health and Preventive Services team, and I'm really excited to talk to you about this topic today. So let's jump in. Today, we're going to walk through what inflammation is. We'll talk about acute versus chronic inflammation and how those relate to the immune response. We'll also talk about instances where our immune system does not function properly and how that might influence the inflammatory response. And lastly, we'll talk through some of the causes and preventive measures for inflammation. So let's just kick off by defining what inflammation is. Inflammation is a natural response and a coordinated set of events for how your body taps into your immune system, which protects you from harm. So inflammation is not necessarily a bad thing. In fact, it can be a very healthy response. Inflammation occurs when your body detects potential infection or damage to tissue. Inflammation can be considered either acute or chronic. Acute meaning a sudden onset and lasting only short term, so rapid or quick onset with short duration, like just a few days. Whereas chronic means persistent or long lasting, developing slowly over time, such as in years. An acute problem would be a broken bone, whereas a cold, a headache, whereas a chronic problem would be arthritis, heart disease, or diabetes. And the two responses, both acute and chronic, play out differently. Though there are similarities, each of them can impact our overall health a little differently. So we're going to unpack each of the two responses. Acute inflammation is our body's attempt to preserve damaged tissue or to clear pathogens like bacteria, virus, or others like microorganisms that essentially would have the potential to cause disease. We need to quickly mount our defense to get rid of potential harm. And there are a few key signs that we have engaged an acute response. Typically, there's going to be swelling, redness, pain, perhaps heat, and even altered function. And then beyond what we can see and feel, in acute inflammation, there is an abundance of neutrophilic activity. And neutrophils are the most common type of white blood cell in the body. They quickly rush to the damaged or infected area, and the job of a neutrophil is to capture and destroy harmful microorganisms. Now, I mentioned that they're the most common type of white blood cell in the body, and about 50 to 80% of all white blood cells are neutrophils. And they are created in the bone marrow, and then they travel throughout your circulatory system to the rest of the body and tissues. While they're usually round or spherical, they can change shape to fight infection, and they work by trapping and ingesting pathogens to destroy them. But how do they know how to arrive? Well, first, there's that damage or infection. So microbes get past the first line of defense, which is either the skin or the mucus. And when that happens, there is first going to be vasoconstriction. So our vasculature constricts, and that's going to help to prevent blood loss. Next, our body is going to engage cytokines and inflammatory mediators, which are essentially molecules that act like messengers. Histamine is a mediator which promotes inflammation in order to signal to your immune cells, hey, right here, this is the site that we need your response, right here. This also causes vasodilation, which is the dilation of our vasculature, so allowing for those immune cells to travel from the blood to the site of the infection or damage. And now remember, neutrophils are the first to arrive, and they work to rid the body of harmful microbes. So the inflammation response is meant to damage microbes. However, it can at times cause damage to the actual tissue itself. And often that's when we hear the suffix itis, I-T-I-S, such as arthritis, colitis, appendicitis. This indicates now there is also potential for the tissue itself to become damaged. And I mentioned kind of this first line of defense where the actual tissues and mucous membranes in our bodies help to keep the microbes out. But when that is breached, our body's next line of defense is a fever. And that is a temporary rise in our temperature overall. And what's considered to be a true fever is anything over 100 degrees Fahrenheit when taken orally. So why does that even happen? Our bodies increase temperature in order to stifle the growth of bacteria or viruses, as well as preserve some of the enzymatic functions that occur better in our bodies at lower temperatures, so that we can shift our priorities. And instead of focusing on those enzymatic activities and functions, our bodies can now focus on the fight against the pathogen. When we shift to this more secondary immune response, and also when there's more chronic or long-lasting inflammation, the mix of white blood cells starts to look a little different. As opposed to an abundance of neutrophils as the first responders, during this long-lasting form of inflammation or ongoing fight, we start to see an abundance of macrophages, T lymphocytes, and giant cells, which is 2 or more macrophages, and all of these function a little differently. Some of them can even join together to form what is called a granuloma, which is essentially a wall around microbes, so that they are if they're not easily destroyed, we can at least wall them off to prevent them from spreading. Now, inflammation is produced as a response from the immune system. So it's important that we unpack how our immune system works in order to best understand inflammation. Most of the response we've been talking about so far is a function of your innate immune system, or the immune system that you are born with. The physical barriers like your skin, your mucous membranes, as well as the cells and what we just talked about, like the neutrophils that take immediate action when there is an invasion. But this isn't the full picture of your immune system. You also have adaptive or acquired immunity, which uses B lymphocytes to produce antibodies or proteins that help against specific invaders. So after your first exposure to a particular pathogen, your adaptive immune system can now recognize and defend against future exposures to this invader. For instance, if you had chickenpox, your body recognizes future exposures or new exposures to the virus in order to defend and prevent you from getting sick again. This is where the science of immunizations comes in, because it's going to help your body to make antibodies, which provide protection from specific pathogens. The inflammation that is produced by the immune system is natural. Our immune system is highly sophisticated. Our innate system engages when there is a breakdown or when that first line of defense is not enough. Our adaptive immune system starts to fight with even greater precision. And this happens all day long. So we are continuously exposed to internal and external threats. Our immune system is such an unsung hero, in my opinion, for the countless hours of work it is constantly putting in. However, there are scenarios where inflammation or the immune system goes overboard or it does not function properly. So let's talk about some of those now. The first of which would be immune deficiency. So some people are just born with a weak immune system, and this is referred to as primary immune deficiency. There are over 400 types of primary immunodeficiency, and most are caused by very specific genetic mutations, so there's no way to prevent them. The severity of immunodeficiency can range, and these are pretty hyperspecific in that the mutation could involve over or underproduction of a particular protein or a particular immune cell. And when that happens, the impact is very specific to the respective signaling pathway or metabolic process that follows. So for example, in chronic granulomatous disease, or CGM, phagocytes, which are a type of white blood cell, are unable to kill certain types of bacteria and fungi, and that makes individuals with CGD more susceptible to specific infections. The second thing that can go wrong is acquired immune deficiency, and this can be temporary or long-term, and this happens when there is some sort of exposure or disease that weakens the immune system over time, which is referred to as acquired immune deficiency. And examples of acquired immune deficiency include neutropenia, which means low white blood cell count, and this is usually caused from things like radiation or chemotherapy treatments, and is usually temporary, lasting a certain amount of time after the treatment, and then resuming a more normal status. Acquired immune deficiency syndrome from the HIV virus is another example. And chronic conditions like diabetes and cancer can also cause secondary immunodeficiency. So in the example of type 2 diabetes in particular, high blood sugar levels trigger inflammation, and that inflammation can damage your tissues, your organs, and your immune response over time. And a weakened immune system has a harder time fighting off infections. So individuals with type 2 diabetes are more likely to get sick from things like respiratory tract infections, skin infections, the flu, and it may take longer to heal when there is a cut or a wound. On the flip side of immune deficiency, some people have overly active immune systems, such as people who have specific allergies. An allergic reaction to different environmental factors like dust, pet dander, pollen, or even particular foods is caused by an overzealous immune system and inflammatory response. So in addition to allergies, there are also some inflammatory conditions caused by an overactive immune system, and that would be things like asthma, which is an inflammation of the airway or the lungs, eczema, which is a group of different inflammatory skin conditions, and rhinitis, or inflammation of the nasal cavity, which feels kind of like a stuffy nose or excessive sneezing. And then again, there are times when that immune system or inflammation is overactive and the immune system attacks the body itself in autoimmune diseases. And in these conditions, the immune system doesn't necessarily know the difference between an invader and your healthy cells or tissues. So the immune system will actually attack healthy tissue. Examples of autoimmune conditions include things like lupus, where the body can attack many different systems, from the lungs, the kidneys, the skin, joints, and even the brain. And in the picture you see on your screen here, the gentleman has a little bit of a rash on his face and kind of almost a butterfly pattern under his eyes, and sometimes presents on the nose as well. And that's a signature presentation in a lupus flare. So that's why that picture is included. Another example of an autoimmune condition would be type 1 diabetes. In this, the body attacks the cells that produce insulin, which is needed to regulate glucose levels. So the big difference between type 1 and type 2 diabetes is that in type 1, this is an autoimmune disease where the body attacks the pancreatic cells that make insulin. Whereas in type 2 diabetes, either the pancreas isn't producing enough insulin or the body isn't using insulin like it should. It becomes resistant. So there's not that autoimmune component. Now, rheumatoid arthritis is another example where the body attacks the lining of the joints without isolation to one particular joint, but that can also extend to the skin, the eyes, the lungs, and the vasculature. And multiple sclerosis is another example where the body attacks the myelin or the protective covers or nerve fibers, which ultimately impact brain and spinal cord function. So what causes these different instances where inflammation and the immune response go awry? For primary immune deficiency, we mentioned earlier that most of these conditions are purely genetic. And so they're resulting from a mutation of certain genes, something that is beyond our control. For acquired immune deficiency, we talked about how exposure to certain treatments like radiation and chemotherapy can cause secondary immune deficiency. Certain medications, chronic conditions, as well as infections, severe burns, and poor nutrition can also lead to secondary immune deficiency. When it comes to instances where our immune system and inflammation are overly active, like in asthma or eczema and those autoimmune conditions where the immune system attacks healthy tissue, the causes are not quite as clear. It's thought to really be a combination of family history, genetics, and then environmental conditions. And while these conditions can be medically managed, for those with asthma, lupus, and rheumatoid arthritis in particular, there are generally things in the environment that can trigger an attack or a flare of the inflammatory response. And it can be something as simple as a change in the weather or high levels of stress, and it is very person specific. So a trigger for one person might not impact another. And so acute inflammation is not a bad thing, and it may feel uncomfortable at the time, but it is your body's natural response to help heal or recover, and it will go away. Whereas chronic inflammation or some of these conditions where it's more long lasting and there is that low level immune response that doesn't go away, and you might not even know that there's inflammation there because there are no noticeable symptoms because it's occurring within your body, not necessarily presenting outwardly. It could even be occurring at the cellular level. That's when things are a bit more concerning. And what's interesting is that it's a little bit of what came first, the chicken or the egg. When you have a chronic condition like heart disease, diabetes, or arthritis, progression of your condition can cause inflammation. On the flip side, inflammation can exacerbate or worsen and progress your disease. So there is a definite correlation between inflammation and many conditions like cardiovascular disease, and that includes heart attack, hypertension and stroke, metabolic syndrome, obesity, type 2 diabetes, neurological conditions like Alzheimer's, Parkinson's, dementia, and GI conditions like irritable bowel disease, and then those autoimmune conditions we discussed just a bit ago. And there's also new research that's coming to light around inflammation's association with depression. So it's not quite clear. Again, I said it's a little bit of the chicken or the egg. What's first, the disease or the inflammation, and which progresses the other? But what we do know is that there's a clear correlation between inflammation and these conditions. And we know that there are some lifestyle factors that can contribute to inflammation and therefore potentially are a risk for some of these conditions. The first of which is drinking excessive alcohol. Drinking more than one drink for women or more than 2 drinks a day for men can increase the inflammatory response. And when I say one drink, that means either 12 ounces of beer or 5 ounces of wine. So drinking excessive alcohol means 1 drink a day, more than 1 drink a day for women, or more than 2 drinks a day for men. Exercising either not enough or at too high of an intensity too frequently can also increase the inflammatory response. Repeat exposure to stress hormones, which are produced when we are stressed, also contributes to inflammation. And then if you are a smoker or a vape user, you are exposing yourself to toxins that promote inflammation. Having excess body weight promotes inflammation, as excess fat cells stimulate the inflammatory response. And then eating certain foods in excess can increase inflammation. And those include foods that are high in added sugars, fried foods, foods that contain trans fats, and overly processed foods like commercially baked goods like cookies and cakes, and processed meats such as hot dogs and bologna. So knowing that these things can increase inflammation, let's talk about what we can do to prevent inflammation. A healthy diet is a great place to start. And while there are no individual foods that will decrease system-wide inflammation, and while the understanding between diet and inflammation is very complex, focusing on fruits, vegetables, and whole grains and healthy fats is a great way to ward off inflammation. Examples of whole grains would be things like brown rice, quinoa, whole wheat breads, barley, bulgur, farro. Start getting adventurous in the grain aisle. And while a variety of vegetables is a great start, the kind of anti-inflammatory superstars are leafy greens and cruciferous vegetables. So that would be things like spinach, chard, kale, mustard, turnip, and collard greens, bok choy, arugula, and lettuces like romaine. And then the more cruciferous vegetables, things like rutabaga, broccoli, Brussels sprouts, cauliflower, and watercress. So we're going to mix it up in the grain aisle, and now we're going to mix it up in the salad aisle, and in the produce section. And remember, a lot of these greens can stand alone with a huge flavor punch, but they are also really great just cooked into recipes and added to dishes. When it comes to fruits, berries, strawberries, blueberries, cherries, raspberries, blackberries, those are great places to focus, and again, kind of consider those anti-inflammatory superstars. For healthy fats, bringing things like olive oil, fatty fish, salmon, tuna, mackerel, and nuts and seeds is a great way to enhance the anti-inflammatory properties of your meals. Now, there are 2 eating patterns in particular that have shown really great promise in inflammation prevention, and they are first the DASH diet, which stands for Dietary Approaches to Stop Hypertension, and then the Mediterranean diet, which has a great focus on whole foods and healthy fats. These 2 eating patterns have been combined to form the MIND diet, which stands for Mediterranean Dash Intervention for Neurodegenerative Delay. And if you want to read more about that specific eating pattern, head on over to the web and look for the MIND diet. You can find some excellent, credible sources, particularly some great information from WebMD or the USDA, but that will walk you through what that diet includes, and it is very forward in whole grains, vegetables, fruits, and healthy fats. And walk you through a lot of the research showing the promise that the MIND diet has to potentially not only prevent inflammation, but treat inflammation as well, with really the focus coming from cognitive delay. So its role in inflammation in dementia and Alzheimer's. Really interesting stuff. In addition to eating a healthy diet, exercising regularly is a really great way to counter inflammation. Regular exercise helps us to regulate our immune response, and it can increase our insulin sensitivity and may improve our ability to regulate our blood sugar. And remember, that is important because when we talked about how the development of type 2 diabetes can lead to inflammation and secondary immune deficiency, we can start to see how important it is to regulate our blood sugar, not only because of the role with diabetes, but the potential for inflammation and the complexity between those two things. Aiming for 150 minutes of moderate intensity activity is a really great place to start. And that could be from dancing, walking, Pilates, whatever moves you to move, it counts. So you want to also include strength training at least 2 days a week. And there are so many great resources over on the Optima Health website. If you look at the prevention and well-being section of our webpage, you'll see a movement section where there are great programs. We have one particularly around maintaining muscle mass, and then one around just movement in general called the Move About program. And then if you're a member of Optima Health, also head on over to your WebMD Health Services account where you can get free support in your movement goals by engaging in a daily habit. Now, exercising regularly and eating a healthy diet will also help to promote a healthy weight, which of course reduces inflammation. Managing your stress helps to manage and reduce inflammation as well. So I mentioned earlier that the stress hormones contribute to inflammation. Therefore, keeping our stress in check is going to help prevent inflammation. Things like yoga, deep breathing, mindfulness, and just general other forms of relaxation. For you, that might mean cozying up with a good book or taking a walk in nature, having a cup of hot chamomile tea, saying a prayer, or closing your eyes and doing some guided imagery. If you have not tried out Tai Chi before, I highly recommend that as a cool way to help manage your stress and also get some movement in. And we have free Tai Chi resources on our Optima Health website. So check out one of our free Tai Chi classes and give it a go today. Lastly, if you are a smoker or vape user, work towards quitting. The Get Off Your Butt, Stay Smokeless for Life program that Optima Health offers is going to help guide you to a smoke-free life. So again, over on the Optima Health website, check out the Stay Smokeless for Life program. And that's just a really great way to help you think about quitting tobacco and then support you through your journey as you're ready for that change. Now, of course, sometimes we may do all of these things or some of these things, but still have chronic inflammation. And that inflammation can make our activities each day more difficult. So sometimes we need other treatments to help us manage inflammation. And those can really look different depending on what's behind your inflammation, meaning that the treatment for someone with Crohn's disease is going to look very different than the treatment for someone with lupus. So you'll want to talk through your symptoms with your provider so that you can understand what's going to be best for you individually. There are certain supplements that can be helpful, but the message I really want to convey is that you always want to check with your provider before you begin any sort of supplementation, because they are going to help you to understand what the appropriate amount is, whether or not there are side effects or interactions with any of your other medications, and whether it is even appropriate for you to consider. So definitely talk to your provider, but supplements that can support our immune function can also help to ward off inflammation. And those can include things like vitamin A, C, D, and the mineral zinc, and then fish oils as well. But guess what? The Mediterranean diet or the MIND diet and the healthy foods that we just talked about feature a variety of all of those nutrients. So it is much better to round out your diet before jumping into supplementation. There's also a lot of conversation around turmeric when it comes to inflammation. And turmeric is an herb sometimes called the golden spice because of its rich color and warm flavor. And if you have ever enjoyed a traditional Indian curry, then you've likely had turmeric before. Some studies suggest that the curcumin, which is a compound or a phytochemical found in turmeric, may actually have anti-inflammatory properties. Curcumin isn't as well absorbed by our digestive tract as some other things are. However, heparin, which is a compound found in black pepper, may actually help to enhance the absorption of curcumin and turmeric. So a lot of times black pepper is brought into the turmeric conversation. You don't have to have it, but a dash of pepper to your turmeric recipes may help to increase the absorption. I want to point out that research is very early and there's no clear recommendation on how much curcumin may offer anti-inflammatory properties. So just like the supplements we discussed earlier, you want to check with your doctor or even a registered dietitian before starting any sort of turmeric supplementation. Or before consuming high doses of fresh turmeric, because just like with anything, it is possible to overdo it, especially if you have a chronic condition or take medication regularly. So your provider will be able to help you understand more. I also hear garlic brought into the inflammation conversation quite a bit, and some research over the past few years has suggested that garlic offers some protective benefit to our heart and our brain, and even our immune system, and therefore the inflammatory response. However, big asterisk, research is still very early. The mechanism of action for garlic is not quite clear, and we are not sure if this is actually translated to the garlic that we eat, whether that's cooked, raw, crushed, minced, or powdered. So it is quite a big leap to think that supplementing with garlic will help with inflammation. However, garlic is a great prebiotic fiber, which helps to support the health of our gut, which is closely tied with our immune function. Inflammation treatment may also involve anti-inflammatory medications like ibuprofen, naproxen, and aspirin. Some of these are sold over the counter, and then some are prescribed at higher dosages. But just like with supplements, you'll want to check with your provider too to see what's best for you. Steroids are another common treatment for their ability to reduce inflammation. They can really be used in a variety of conditions. And then, of course, there are very condition-specific treatments, such as anti-rheumatics and biologics, which are determined by essentially the progression of the underlying condition that may be driving or worsening with inflammation. Lastly, there may be times when surgery is implicated, either to repair or replace a problematic joint in the case of arthritis, or maybe to remove damaged tissue in the instances of things like Crohn's or inflammatory bowel disease. But as we kind of round out our discussion, I just want to step back and summarize that inflammation is a normal response, especially acute inflammation. It is a result of our body engaging our immune system to help us stay healthy. However, what we don't want is that response to become long-term or long-lasting. And if it does, there are several tools in our arsenal to help us combat inflammation. When we focus on a healthy diet, regular exercise, stress management, which includes good sleeping habits, quitting tobacco, and managing our weight, we are actively taking steps to prevent and treat inflammation. However, some things are beyond behavioral intervention, and we need to consult with our providers to help us manage what we cannot. So if you believe you're dealing with some unchecked inflammation, I really want to encourage you to have a conversation with your provider soon, and I wish you the best on your journey towards health. Please check out some of the resources I shared with you today. And with that, I'm just going to slide over to the resources used in this presentation, and I want to thank you for taking the time to listen. Have a wonderful day.